morning friends, we would be just recollecting the FMG 2023 ophthalmology questions, and I am very glad to tell you that all the questions in the ophthalmology have been previously taught in my lectures and in my notes, so you can basically trace all of them. So this would be a very short video where I would be just discussing the questions and their brief explanation with the answers. If you have any doubts, if the question was not like that, you can put it in the comment section. We can basically discuss it again. So the first question was that a patient presented with the sudden loss of vision in the morning. The fundus photo was given, and very easily you can see a cherry red spot in the center, and you can see the cattle trucking of the veins. Okay, and they have asked you about the diagnosis. Diagnosis is very clear, that is a central retinal artery occlusion here. Okay, so the answer here would be A. The second question was a patient presented with the visual field like this. The patient is expected to have the lesion at which of the part of the visual pathway? You can see here there is a bitemporal hemianopia. So whenever there is a bitemporal hemianopia, that means that the nasal fibers of both right and left side, they are involved. You can see the various types of visual pathway defects in our lectures of neuro-ophthalmology. So answer is very simple here, that is central chiasm. So the next question is a patient presented with the visual fields like this. The lesion is said to be anopia, homonymous hemianopia, heteronymous hemianopia, or pie in the sky. So in this case, this is called a homonymous hemianopia. What is the meaning of homonymous? That the same side of the visual field is involved in both the eyes. So let's say this is the right eye and this is the left eye visual fields. So this is the right side of the right eye visual field, and this is also the right side of the left eye visual field. So because the same sides are involved, so I call it homonymous hemianopia. So the answer here would be B. So next question is a patient was looking on the right side on an object. He was using the two yoke muscles. The pair is, your options are right lateral rectus, left medial rectus, right medial rectus, left lateral rectus, both eye lateral rectus, and option D was right medial rectus, left superior oblique. So in this question, basically when the patient is seeing dextroversion, so he is using the right lateral rectus and its yoke muscle is left medial rectus. So the answer here would be A. So next question was another previous year question where they have asked about a 10-year-old male with intention tremors, hepatomegaly and CNS changes, and this is the anterior segment photograph where you are seeing the Wilson's ring, the KF ring in the peripheral cornea at the level of limbus. So this is basically the copper deposition which is seen in the Wilson's disease, and the systemic features are also correlating. Next question was a 60-year-old patient presented with the 6/60 vision with normal fundus and no cataract. The patient also not improved by the refraction. What is the probable diagnosis? So the diagnosis here is the amblyopia, where the vision is not corresponding as compared to the structural features of the patient. So this is amblyopia. If they would have asked a 60-year-old patient came with a 6/6 vision for the distance and N36 for the near vision, then the answer would have been presbyopia. What is the index myopia? If the patient has come with a 60-year patient with 6/60 vision and the patient is having a cataract and this vision is improving to 6/12, let's say, and there is a -3 diopter autorefractometer reading, so then this means there is a myopia. In hypermetropia, what can be the option? That if the patient is having a 6/60 vision, the patient is also having a cataract, and your index hypermetropia is when the AR is on the positive side, let's say plus 2.5. So that is the index hypermetropia. So these are the various situations in this type of question. The next question is a previous year question where they have asked about the diabetic cataract. Remember, the diabetic cataract, the most important feature is the sorbitol metabolism, because in that case the lens basically becomes intumescent and becomes cataractous. So next is they have asked about the spotter. This spotter where you can see the reddish purple demarcated area, this is basically a capillary hemangioma. So next question is they have asked about a 36-year-old patient with headache and vomiting and the fundus picture like this. So this is dilation and tortuosity of vessels, and you are seeing a bilateral disc edema, and the clinical features are basically corresponding to increased intracranial tension. So the answer here is papilledema. So next question is they have asked about a field defect like this where you have a homonymous hemianopia, same side is involved, and you are having a basically a macular sparing. So this is the patient who is having a posterior cerebral artery infarct, because the central area is basically supplied by your which artery? The middle cerebral artery. So that is spared. So you have a macular sparing in that case. So these were the various questions which were asked. If any of the question which is basically left, you can just mail it to me or put it in the comment section. We would try to answer it as soon as possible, and hope you would have liked this session. And if you have any doubts in ophthalmology, you can ask us, and you can join my WhatsApp group by basically messaging me at this number. Thank you very much for seeing the video.